Dr. Alan Wolfelt. I'm the director of the Center for Loss and Life Transition, located in the foothills just west of Fort Collins, Colorado. What a privilege to be asked by the folks at EricsHouse to speak a little bit about how they're making use of my companioning model of grief care. As you probably know, EricsHouse is a nonprofit organization that uses an integrative model of supporting people, particularly those affected by suicide death and overdose deaths. And I am, again, privileged that they're making use of my philosophy and practice of not treating people, but companioning people. How did I come to know the folks at EricsHouse and be a supporter of their very important mission? Mary Ann reached out to me and has participated and become one of our graduates in our Death and Grief Studies certification, as well as April and other people who are currently going through our trainings. We're just so excited to have them putting to use in practical ways our heart-based, compassionate model of grief care. How does my companioning model interface with the mission of EricsHouse? Well, I just really appreciate that they resonated as they learned more about it, the important distinction we make between treating people in grief versus companioning them. As you may know, the word treat comes from a Latin root word tracture, and it literally means to drag. If you were to combine that with the word patient, I'd remind you that patient means passive, long-term sufferer. So if we treat patients, we drag passive, long-term sufferers. Of course, the last thing a bereaved person, remembering that bereavement means to be torn apart and to have very special needs, the last thing that a bereaved person needs is to be treated, to be dragged. Instead, we know by its nature that grief is recursive, it's slow, it calls out for convalescence. So we need to match up our caregiving models with that reality that when you're bereaved and torn apart, people need to come alongside you, not drag you forward, but understand the need that is required related to making that distinction between a treater and a companion. Very briefly, I won't read all of my 11 tenets to you, but I thought it might be helpful to just introduce a few of those so that there's an understanding of that critically important distinction. A companion knows that their role is to come along beside someone, to be present to another person's pain, to not take pain away. Companioning metaphorically is about going to the wilderness of another human being's soul and not thinking you're responsible for finding the way out. Companioning is about honoring the spirit, not about focusing on the intellect. I often say you can't think through loss. You literally do, in fact, have to go from head to heart and feel your way through loss. Companioning is about listening with the heart. It's not about analyzing with the head. Companioning is about bearing witness to the struggle of others, not judging or directing those struggles. And I'll just mention one more. Companioning, of course, is about walking alongside. It's not about leading. The true expert of grief is the mourner. And the central tenet of a companioning model is to honor that reality, to enter into their phenomenological reality, that when they teach you what they're experiencing, to affirm that on any path to their ability to integrate that loss into their life. So again, that's a very brief introduction to the model, the philosophy, and then we teach through 150 hours of study how to take that philosophy and put it into caregiving action, to not just have a body of knowledge about grief, but to actually have the companioning skills needed to truly support somebody physically, cognitively, emotionally, socially, and spiritually. My hope is that you will be supportive to finding people in your area who might benefit from the services of EricsHouse and let them know about them as a viable resource for people needing to take their grief and allow it to become authentic mourning. What's that distinction? You know, oftentimes people use those words synonymously. You need to grieve or you need to mourn. Grief is your internal response. Mourning, in contrast, is the shared social response. EricsHouse, as I've come to know the people and the place, has created a place of sanctuary where people can disengage from normal demands and give attention to the need to openly and authentically take their grief from the inside to the outside. That's how we integrate loss into our lives. And they do that in the foundation of hospitality, best defined years ago by Henry Nouwen, who's had hospitality is where people come together who may initially be strangers and they become friends and they walk alongside each other and they honor the need again to openly and to honestly mourn. So again, if you find it this mission is something that you would like to contribute to, or to be a part of, or to be supportive of, or to refer people to, I can't encourage you enough to reach out to my good friends at EricsHouse and be a part of helping people in the general Phoenix area, regionally, and even beyond that, get the help that they both need and that they deserve. Thank you very much. I hope to have the opportunity to meet you at some point.